experts who will give the next report. Professor Huang Xiaoli is a chief physician in Department of Children's People's Hospital of Guangxi Autonomous Region. During the course of his career, he has published over 20 academic papers in professional core journals related to sufficient OG contrast, enhanced ultrasound. Professor Huang Xiaoli will give a pitch. Thank you.
Good afternoon, experts. It's a great honor to be here to learn and exchange with you all today. The topic I am going to report on today is the clinical application of musculoskeletal ultrasound. First, let's start with the first part of our content, the introduction. What is the musculoskeletal ultrasound? Musculoskeletal ultrasound is the use of high-frequency ultrasound probes to examine joints, tendons, ligaments, peripheral nerves, and other structures. It can be combined with dynamic observation to accurately assess the lesion of other structures. It can be combined with dynamic observations to accurately assess the lesion of the above structures, such as tendon and ligament injuries, anterior peripheral nerve diseases, and inflammatory joint diseases. For musculoskeletal ultrasound examination, high-frequency probes are used. During the examination, it is important to ensure good coupling between the probe and the skin. Bilateral comparison, combination of short and long axes, and the combination of static and dynamic observations. In addition, we would like to remind everyone to pay attention to a common artifact in musculoskeletal ultrasound, anisotropy artifact. In musculoskeletal ultrasound examination, a slight change in the angle between the fibrous structure and the incident sharpening can lead to a significant change in echo, which needs to be corrected by adjusting the angle of incidence to avoid misdiagnosis. Next, let's take a look at how musculoskeletal ultrasound displays some structures. If you want to examine the cartilage of the knee joint, place the probe here, and you can get its image, a homogeneous band-like low echo. If you need to examine the medial nerve in the wrist, place the probe here, and you can get the short axis image of the medial nerve. It looks like a C-like structure. And when you rotate the probe by 90 degrees, you can get its long axis, a bundle of parallel low echo strands. If you need to examine the anterior fibular ligament of the ligament of the anterior talofibular ligament. Place the probe here, and you can get the image like this. If you need to examine the quadratus tendon of the knee joint, place the probe here, and you can get an image like this. From the above images, we notice that the structure and sonographic characteristics of ligaments are similar to that those of tendons. How can we differentiate them? The ligament originates from the bone and terminates at the bone as well. The tendon, on the other hand, originates from the muscle and attaches to the bone at its terminational point. Now we move on to the second part of the content, case sharing. Case 1. Male, 43 years old. The patient has had the sprained left foot for several days. From the two images, we can see that the anterior talofibular ligament is swollen with discontinuity. There is a swelling of the surrounding soft tissue and increased blood flow signals can be observed. And this image shows the normal size anterior talofibular ligament. Through bilateral comparison, it's not difficult to identify the difference between the two. Finally, the patient can be diagnosed with a rupture of the anterior talofibular ligament. To determine if it has completely ruptured, we can perform an ultrasonic anterior jaw test on the anterior talofibular ligament, as shown in the video. I'm sorry, the dynamic videos can be placed. From the video, we can see that it is a complete fracture. Case 2, female, 46 years old. The right lower leg is swollen and painful for several hours. This image shows we can see under this picture we can see from this picture we can see a tear at the distal end of the medial head of the gastrocnemius muscle, and this is an normal one. This is a panoramic image of the case. Obviously, this patient is a typical tennis leg. Tennis leg caused by traction that leads to detachment of the muscle tendon junction, commonly seen in rapid movements and frequently occurs in the tricep of the lower leg. Sonograph its ultrasound image shows a band-like hypoecho and anoecho area at the muscle tendon junction and hematoma extending along the tendon sheath. Case 3, male, 48 years old, experiencing pain in the left heel after exercise and unable to flex the ankle joint. The left image shows the long axis of the patient's Achilles tendon, where discontinuity is visible, and anechoic feeling can be seen between the broken ends. And this picture, there is also another picture, but I can't find the picture. We can see this is a normal Achilles tendon, and the video is a dynamic ultrasound examination of ankle joint during passive flexion and extension. And this video can be played. The content on this slide is the ultrasound manifestations of complete and partial tendon tears. The left image is sole active view of the normal shoulder joint supraspinatus tendon, and the right image is a view of the partial tears of the supraspinatus tendon. Case 4, male, 46 years old. The patient has pain on the radial side of the right elbow and is unable to lift heavy objects to or twist towers. The left image is the long axis of the patient's common extensor tendon, showing tendon swelling, reduced echo, and multiple irregular anechoic areas within the tendon. The right image shows the tendon filled with blood flow signals. It is not difficult to diagnose this condition as lateral epicondylitis or tennis elbow. The following images are the long axis images of the normal common extensor tendon with the placement of the probe shown on the left side of the image. We perform an ultrasound-guided injection treatment for this patient. First, we perform hydrodissection with souring on the surface of the common extensor tendon. Then, we treat it with ozone. Due to time constraints, I will skip the following case. Let's move on to the case 6. Female, 56 years old. The patient experienced pain and clinking in both thumb joints. This is a physical examination video. The left thumb has more severe clinical than the right. Ultrasound image shows thickening of the A1 pori on the left thumb. The patient can be clearly diagnosed with tenosynovitis or trigger thumb. The following video is us treated the patient's left thumb, first separating the tendons under ultrasound guidance, and then released the A1 pulley. After the treatment, the snapping of the patient's thumb disappears immediately. This is an introduction to the finger pulley system. I'm not going to elaborate on it now, and this image shows a normal A1 pulley with a thumb. Case 7, female, 45 years old. The patient has had numbness in the 3 fingers on the radial side for more than 5 months. Ultrasound shows that the median nerve is compressed and thin at the carpal tunnel, which is a typical carpal tunnel seizure. Then we first perform water separate on the surface of the median nerve, then release the transverse carpal ligament, and finally treat with the steroid mixture injection. This is the SWE image of the patient's medial nerve before and after surgery. The post-operative SWE shows the medial nerve is softer than before the surgery. And the self-scoring on the scale 1 month after the operation is also lower than before. It indicates that our treatment is effective. Case A will be skipped here. Finally, let's summarize. Musculoskeletal ultrasound can assist in diagnosis, evaluate treatment efficacy, and guide precise treatment under ultrasound. Since 2018, we have been holding musculoskeletal ultrasound training courses in our region, and we welcome experts to come and exchange ideas. That's all for today. Thank you for your attention.
Huang Xiaoli, clinical application of musculoskeletal ultrasound. The application value of musculoskeletal ultrasound in sports medicine or session in diagnosis, evaluation, efficacy, and ultrasound guided precise treatment. The application value of musculoskeletal ultrasound in rheumatism or system only diagnosis, monitor disease activity, and evaluate effect. Polity disease recovery, guard jolt, severity, pinch, and severe biopsy. Ultrasound guard pinch treatment. Thank you.